Well, the title of my book is Be the Change, Transforming Healthcare from the Inside Out. And I often get questions from people asking, how can I, as one individual person, have any role in transforming healthcare? And my answer to that is a big one. No matter what kind of structure we have, what kind of healthcare delivery system we develop, each of us must be responsible for our own health. We have to eat healthfully, exercise, manage our stress appropriately, because now we are seeing that almost all of the chronic diseases that we deal with in modern American medicine are the result of poor lifestyle choices. Obesity, diabetes, heart disease, depression, dementia, you name it. All of these chronic illnesses, while they have some medical treatments, stem from poor fundamental lifestyle issues. So we have to take responsibility really for our own health and not expect a pill for every ill that we run to the doctor and get some medicine instead of us changing our lifestyle to be more healthy. I think we also have to realize that just as we have our own family budget and we can't afford every single thing we might want on a daily basis, we also can't afford everything in healthcare. And while we have wonderful technological breakthroughs and new medications and transformative surgeries, not always are those absolutely appropriate, or can everyone get them because they're very expensive at times. So we really do have to discuss the word rationing, which nobody wants to talk about. It raises hackles in many quarters, but it is happening every day by your insurance company deciding what they will cover in terms of what medications are on the formulary, whether you're eligible for some kind of expensive treatment for cancer or other diseases. But we don't know how they're making those decisions. If we could have rationing be open, transparent, public, involved in the discussions, and we understood why decisions were being made on the basis of evidence for effectiveness, cost, risk, etc., then I think it would feel much more fair that all of us are subject to the same rules about what can be afforded and what is appropriate. And then finally, we have to seriously face and discuss the end of life. Death is not something that's very comfortable for most of us to talk about or realize. Everyone, including us, ourselves, will die. And we need to have a plan for the end of our life so that it can be as peaceful and graceful as possible. It is very possible to have a healing death, and the end of life can be a very important time period for the person and for their family. And that we shouldn't always just think one more test, one more surgery, one more drug is always the best answer. And that if we face the reality of death and handle it appropriately, it can actually be a healing experience. I wrote a book called Be the Change, Transforming Healthcare from the Inside Out. It's about this topic and many more. If you'd like a free chapter of my book, go to www.bethechangehealthcare.com and I'll send you an email with a link so that you can download this chapter. Thank you very much and have a great day.